Okay, everybody. Well, we're right at about 12:02, so we'll go ahead and get started today. I want to thank everybody who was able to join us either by phone or by web link. As I was discussing, my name is Eugene LeVar. I'm the HAI Program Manager at ADHS.
Surgeries performed.
Somebody had us on hold for a minute. If you're unable to get into iLink, I do apologize. Sometimes there are
Flagstaff Medical Center.
Oh, great. Thank you for joining us. We do recommend you can follow along by bringing up the national report, or if you'd like to go to our website at PreventHAIAZ. You can go ahead and bring up the report through the shout-out box, and we'll be reviewing
Charlie Chapin.
Reviewing the pages 28 and 29 today as we go through this. We're also going to attempt to record the webinar. That way we can make it available to individuals who unfortunately weren't able to join us today. We know it was a little short notice, but we do appreciate everybody making some time. And just for a little housekeeping, if possible, please don't place us on hold. That way we can avoid getting the holding music from your facility. And if you want to have any conversations, we do ask that you place us on mute. And then we'll announce, let us know when we have a chance for some question and answers. And that way we can go forward with that, and we can have a nice review through Lindsay at first. And so we just want to go ahead and thank Lindsay Weiner from CDC for taking some time out today and making herself available to go over the Arizona-specific progress that we've seen here, the numbers that we're pulling out, and making herself available for some questions and answers. And I'll go ahead and hand over the floor to Lindsay and bring up the report if you can bear with me for just 20 minutes.
Hey, Nick.
Lindsay, is that the page you'd like me to go ahead and bring up here to start with?
Sure. The Arizona-specific state template would be great.
That's the one I have up.
Perfect. Well, I want to start by thanking everyone for having me today. I'm really glad that we were able to arrange this opportunity, and I'm happy to walk you through Arizona's HAI data that we have included in the 2013 progress report. So hopefully most of you have either seen this specific report or are familiar with the progress report in general. We publish data on 6 healthcare-associated infections, so that would be CLABSI, CAUTI, MRSA bacteremia, C. difficile, and surgical site infections from 2 procedure categories, and those are abdominal hysterectomies and colon surgeries. So I'm going to go ahead and start with CLABSIs at the top left of Arizona's page. So we see next to the acronym that there was a 36% decrease in CLABSIs compared to what we would have expected based on the national baseline data, which is from 2006 to 2008. And we see next to that 36%, it's a green down arrow. That indicates that this is a statistically significant decrease. Okay, so then below that CLABSI bar, we have a paragraph describing what a CLABSI is. And beneath that, we have the first square bullet, which says Arizona hospitals reported no significant change in CLABSIs between 2012 and 2013. So that means while Arizona may have seen a slight increase or slight decrease from last year, that change was not statistically significant. Okay, and then the second square bullet beneath that first one is a blue box with a 7% inside, and that is basically stating that 7% of the hospitals in Arizona that had enough data to calculate an SIR did have an SIR that was significantly worse than the national SIR for CLABSIs. All right, and so that format repeats right below CLABSIs for CAUTIs, which are catheter-associated urinary tract infections. Arizona saw a 2% increase compared to the national baseline. However, note that the arrow next to the 2% is shaded white, meaning that that 2% is not statistically significant. Okay, and then the 2 square bullets in the CAUTI section, we see the first one is shaded white, meaning that there was no significant increase or decrease in CAUTIs compared to 2012. And the second bullet in this section, which is shaded blue with 11%, Again, that indicates 11% of hospitals had an SIR significantly worse than the national SIR for CAUTI in 2013. Both the CLABSI and CAUTI sections contain data from all location types that hospitals reported to NHSN. So for CLABSI, that includes intensive care units, inpatient wards, as well as NICUs. And for CAUTIs, that includes ICUs and wards. Okay, so moving down to the bottom of the left side of the page, we have MRSA bacteremia, which Arizona saw a 3% decrease compared to the national baseline. Again, you'll notice that arrow next to the 3% is shaded white, meaning that that is not a statistically significant change. In the MRSA bacteremia section, you'll notice there's only one square bullet, which is the blue square with a 9%, indicating that 9% of hospitals had an SIR worse than the national. You'll also see that for both MRSA and C. difficile, we do not have that first square bullet, and that's because we did not publish state-specific MRSA or C. difficile data in 2012. So therefore, we can't make that comparison back to 2012. All right, I'm going to move over to the right side of the template now, which are surgical site infections. The first one we see are from abdominal hysterectomies, and there's a 19% increase compared to national baseline, again with the white arrow notating that that is not statistically significant. The first bullet under abdominal hysterectomy shows no significant change in SSIs between 2012 and 2013. And then looking at the blue bullet, we see that there are 6% of hospitals that have an SIR significantly worse than the national. Now this percentage in the blue bullet, if you're not familiar with that calculation, it is calculated only out of the hospitals that have enough data, which means that they're the hospitals that have a high enough denominator that we're able to have at least one predicted infection, which then allows us to calculate an SIR. So for SSI hysterectomy, you can see that the bullet says among the 17 hospitals in Arizona. So while the other HAI types on this page had a higher number of hospitals that had an SIR, it looks like abdominal hysterectomy, there were only 17 hospitals with enough data. So that 6% is 6% out of the 17. Okay, I just want to make sure that that was clear. Moving down now to the SSI colon surgery section, we have 11% increase compared to national baseline. Again, the arrow shaded white. And we see that there's no significant change in SSIs from colon surgery between 2012 and 2013. Moving down to the blue bullet, out of the 39 hospitals in Arizona with enough SSI colon surgery data, 13% had an SIR, significantly worse than the national. And now our last infection type on this first page are C. difficile infections. Those are laboratory identified hospital onset infections. And in that gray tab, we see that there was a less than 1% increase compared to national baseline. However, again, that's not statistically significant. And that blue bullet underneath the C. difficile section states that out of the 54 hospitals in Arizona with enough C. difficile data, 26% had an SIR significantly worse than the national SIR of 0.90. Okay, so that's an overview of the front page. I'm going to go ahead and move to the second page or the back page of Arizona's template, and then I'll pause for questions. All right, so moving to the back side now, you see at the top of the template we provide several hyperlinks to additional information. We have the link to Medicare's Hospital Compare website. We have a full link to the progress report, a link to NHSN's website. We then have a link to the Arizona Department of Health HAI website, and then a link to a separate part of the progress report which provides details on validation efforts. Now looking at this data table, I'm going to start with the leftmost column and move to the right. So the left column we have the different infection types listed, and beneath the acronyms you'll see we have the national baseline for each of those infection types. For some of our HAI types we do use different data that make up that national baseline. Moving to the right, the second column, we have the total number of hospitals in Arizona that reported data on that specific infection type to NHSN. So you can see it averages right around mid-50s to low 60s as far as number of hospitals reporting. And this number does vary because there are some hospitals that don't perform colon or abdominal hysterectomy procedures, or some hospitals that may not use central lines or urinary catheters. All right, so I'm going to move now to the third column. This column represents a change, the percent change in the state SIR compared to last year. So it's a comparison of how Arizona did compared to itself in 2012. So just looking down this column, we see all of the arrows are white, so there's no statistically significant changes. We do have a 1% increase in CLABSI, a 6% decrease in CAUTI, a 3% decrease in SSIs from abdominal hysterectomies, and a 1% decrease in SSIs from colon surgery. All of that was compared to last year. Moving now to the next column, we present a different way to compare the state's 2013 SIR data. So again, these arrows that you see are color-coded. They also represent statistical significance, similar to the arrows that we saw on the front page. So CLABSIs, we have a red arrow pointing up, indicating 19% statistically significant increase compared to the 2013 national SIR. So this is a snapshot of how Arizona is performing compared to the rest of the country in 2013. For CAUTIs, we see a 3% decrease, although that's not statistically significant. Then we move to the surgical site infection rows. So both of these have red arrows pointing up. For abdominal hysterectomy, we have 38%. For colon surgery, we have 22%. So those red arrows again indicate that the SIR is significantly higher than the national. For MRSA bacteremia, we have a 6% increase compared to the national, and then a statistically significant 11% increase in C. difficile infections compared to the rest of the country. All right, I'm moving now to the last column of colored arrows, which is a comparison to the national baseline, which again is represented by those years that were stated in the first column. So looking first CLABSI, again we have a 36% decrease with the green arrow indicating it's statistically significant. For CAUTI, we have a 2% increase, not significant. For SSIs, you see we have 19%, 11% increase compared to baseline. And then for MRSA bacteremia, 3% decrease and a less than 1% increase for C. difficile. This last column of arrows is exactly the same arrows that we saw on the front page in those dark gray tabs for each of the infection types. So then moving over to the right, we have a column for the 2013 state SIR, as well as the 2013 national SIR. So that just allows you to compare those two numbers side by side. Moving down the page now, on the left we explain the standardized infection ratio, and on the right we list the specific prevention efforts that Arizona is either currently or within the past year has been involved with. So we have listed catheter-associated UTIs, multi-drug resistant infections including MRSA, C. difficile, CRE, as well as other organisms. We have a prevention effort for long-term care facilities and hand hygiene, as well as antibiotic stewardship and healthcare personnel influenza vaccination. And I'm sure if you have any specific question on these efforts, the Arizona Health Department would definitely be able to provide more information and explain those further. So I'm going to go ahead and pause now and see if there are any questions about these data on either the front or the back side of the template.
This is Sean Elliott from University of Arizona. Question for the C. diff reporting. Do we have any way of knowing how the C. diff diagnoses were made? For example, was it toxin assay, was it PCR based, and was there a change between 2012 2013?
So we do not have hospital-specific data on that. The NHSN protocol does specify that it must be tested positive by the laboratory, must be toxin positive. Which method the laboratory uses is really up to that hospital and that laboratory. This report does not go into those kind of details, though.
Oh, okay. Because our network went to a PCR-based toxin assay prior to this reporting. We noticed a jump in our numbers just because we had a more sensitive assay.
Right, right.
I just wondered if that might affect the data a little bit.
Yeah, so
it does. And if I could jump in for a moment, hi, Lindsay. Just to
sure.
let everyone know that the expected number for the C. diff SIR does take into account the lab's testing method, and it's part of the risk adjustment. And so
okay.
each quarter, actually, each calendar quarter, hospitals need to update what manner they're testing their Clostridium because of that sensitivity that you brought up, Dr. Elliott.
Okay, great. Thank you very much.
Are there other questions?
Hi, this is Eugene at ADHS. If anybody has any questions, great opportunity to bring it up for Lindsay to comment on. So please feel free to post your questions at this time.
Eugene or Lindsay, where would we find the Arizona-specific report? I see the combined state and national report and then even the line item for Arizona, but where is the Arizona-specific report that you referring to in your presentation?
So I don't know if Eugene could maybe send out the hyperlink to the web page that has the entire report, and on that web page we list each state's name. Next to the state name is a PDF. So if you click on Arizona, that PDF will pull up, and that's the document that contains Arizona's data.
Okay.
We'd be happy to share that link. Maybe Charlie and Sandy would be able to help us push it out to their listservs also, and then that way facilities would have that available.
Thank you.
Sure.
Is there going to be a press release with this information going out?
Yes, there was a national press release. We did forward that to the state health departments, so I'm sure that they could also help us in sharing that with other organizations that were interested.
And when did that go out?
That went out yesterday morning at 9 a.m.
If there's a consensus that you'd like that information also in that PDF, we'd be happy to share that too.
Eugene, who was that requested the link?
Charlie, this is Arica from Banner Desert.
All right, Arica, in the e-blast I sent out, you should have received, that had the link and also ADHS's talking points along with the flyer. But in the content of the email was the link on the CDC website for the full 140-page document.
Right, I think I was referring to the Arizona-specific template with the blue box. I didn't see anything with the blue boxes with the percents. So
Page
that document.
6 and 7, I believe.
6 and 7. Okay.
Is that right, Lindsay? They're not separate documents by state, or are they?
Well, we have them listed in two different ways. It is included in the big 140-page PDF, but for ease for consumers and those using our website, we also list it out separately.
That's right. Yeah, each state was hyperlinked. Yes. Thanks for that.
I think I see it, Lindsay. Thank you. I'm on the CDC site.
Okay, great. I'm glad you could find it.
So I just want to get a little bit more clarification. So on Hospital Compare, it only lists like the ICUs, CLABSI and CAUTI, but on this data, it includes CAUTI and CLABSI from every unit in the facility. So that's why
Yep.
there's discrepancy in like the SIRs for the state in those two databases.
Yeah, that's absolutely correct.
is Eugene again. Any other questions or comments for Lindsay at this time? Well, Lindsay, it sounds like you've gotten the main questions answered, and this is Eugene again. If you do have any questions or do come across anything that you would like clarification on, feel free to email it to either the email address that was included with the blast or on the flyer of HAI program at azdhs.gov, or directly to myself, eugene.lavar@azdhs.gov, and we can work together with Lindsay and her partners to get answers and clarification for you. Lindsay, is there anything you wanted to close with, or?
I don't have anything. Again, feel free to reach out if anyone does have questions or need further clarification on anything. I'll just point out that the progress report does also include a national template with a similar layout compared to the one that we just looked at for Arizona, and it contains national data as a whole. There's also another component of the report which includes information on data validation and data quality checking information from the state. And those are called the State Progress Landscape pages, which you'll see those in the large PDF of the full report. Go ahead.
I just wondered, Lindsay, as far as the report and how states fared, if you've had a chance to do any analysis by state and HAIs and how it falls out in the report. I can tell you that maybe it was 3 years ago, Arizona and only one other state in the nation were the only two states that fared pretty poorly. And, the media got a hold of that and all. And it looks as though Arizona was saved from that issue this time, but I didn't know if you had a chance to look at other states out of curiosity.
Not off the top of my head, but I will tell you that that progress landscape page will be very helpful when you're trying to kind of answer that question, because it lists all states as well as their colored arrows side by side. Kind of allows you to get a sense of how your state is performing compared to the others. I will say that we did have quite a wide range of performance this year. CLABSIs are pretty consistent across the board. Everyone is seeing steady decreases compared to the national baseline. But some of the others, such as the surgical site infections and CAUTIs, we are still seeing quite a range where there's some states that are doing well and able to decrease, and some that are not at this time.
Good info. Thank you.
You're welcome.
Okay, great. Well, I'd like to thank Lindsay for taking some time out and joining us today and making herself available for these Q&As. I also want to thank HSHE and also ASHA for partnering with us for making this available to their listeners. We'll shoot out the recording available within the next couple of days, and hopefully we can share those with the listservs that thank you, everybody, and have a great day.
Thank you for having me.
Thank you.